My guest shares his public health journey that spans an era including periods of the Vietnam War through the COVID-19 pandemic and a whole lot in between. You're listening to the PHEC podcast, episode 392. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Whether you're tuning in for the very first time or you're a regular listener of this podcast, you are in for a treat on this episode as my guest shares his public health journey that spans an era including periods of the Vietnam War all the way through the COVID-19 pandemic, and there's so much in between. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and government agencies that serve Black, Indigenous, and people of color communities, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always humbled and honored to serve. We help our clients collect, analyze, manage, and communicate their data or health information in plain language to communities that they serve. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website, which is DrCHHuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. The links will also be provided in the show notes. I'm very excited to introduce you to my guest on this episode. You'll learn that a large part of his career journey includes Florida A&M University, or FAMU, which is ranked the #1 public HBCU for the 6th consecutive year and has reached the top 100 in the 2025 U.S. News & World Report, ranking number 81 for public universities. Congratulations, FAMU. Many of you know him already, so let me formally introduce him to you, and then I'll connect our conversation. Dr. C. Perry Brown is Professor of Public Health Epidemiology at Florida A&M University. He also is Honorary Professor in the School of Health Sciences, University of KwaZulu-Natal in Durban, South Africa. He teaches courses in infectious disease epidemiology, cardiovascular disease epidemiology, maternal and child health epidemiology, cancer epidemiology, GIS, biostatistics, and data management and analysis. His research interests are in the areas of infectious disease, including influenza and HIV/AIDS, as well as COVID-19, and also health disparities, cardiovascular epidemiology and prevention, cancer epidemiology, and birth defects. Dr. Brown also directs the GIS Data and Spatial Analysis Laboratory in the Institute of Public Health. Dr. Brown's experience in public health and epidemiology has included work in infectious disease internationally, including smallpox in Bangladesh, HIV and AIDS in Congo, Brazil, and Thailand, as well as HIV/AIDS in Los Angeles, COVID-19 response in Florida, and chronic diseases such as cancer and cardiovascular disease, and environmental and occupational epidemiology. Let's connect my conversation with Dr. Brown right now. Hi, Dr. Brown. How are you?
Good afternoon. I'm well. How are you doing?
I am doing very well. Welcome to the podcast. I'm really excited to have you here and to have this conversation.
Well, thank you for the invitation.
It was my pleasure. You and I met in person at the APHA conference in Minneapolis about a month and a half ago. I realized right away we have several people in common. I knew I wanted to have you on the podcast, so that was on my mission to get you here. So
Well, I'm glad to be here.
Let's start with you just telling everyone a little bit about yourself and what you do.
Okay. Well, I am a professor in the Institute of Public Health here at Florida A&M University. The Institute of Public Health was approved by the Florida legislature in 1995. It was funded in 1997. And I came in October of 1997, and I've been here ever since.
Oh, wow. I need to make a trip. As of the time that we're recording this, I have not been to your campus, but I know so many people who complete their degree there, and public health and non-public health folks. I feel like I need to put that on my plan, on my list of places to visit. I need to make a trip down there. So
we'd love to host you.
Oh, okay. We're going to make that happen then. Awesome. All right. Well, let's start with, I'm going to ask you some of the questions I love to ask folks on this podcast. And it's just a way to get to know your journey, who you are, and how you got to this point and what you're doing now. So my first question, it's one of my favorites also. When did you first learn about public health or first become interested in public health as a career?
Wow. Okay. I think my first images of what public health might be or might do was as a result of spending 9 months in Vietnam during the war and looking out over the countryside, looking at what occurred in some of the villages and trash being put out next to the road and asking the question, who's responsible for this? Is there a board of health? Is there a health department? Those were unanswered questions. When I returned and then came out of the service, and I took a course in microbiology. And up until that point in time, I wanted to be a high school biology teacher. That's where I saw my career. And I took this course in microbiology, and we started talking about bacteria and the bacterial revolution in the late 1800s. And someone said that the two magic words, public health. I said, what? Public health? Who are they? What do they do? I had an elective, Introduction to Public Health, Tuesday night, 7 to 10. I was there, and that was it. There was no more biology teacher. That was out the window, and I was just enthralled, not only with learning about what public health does, but specifically about this thing called epidemiology. Oh my gosh, that was it. I wanted to get a master's degree. I wanted to be an epidemiologist. That was the beginning of the journey.
I can relate to that. You know, I have a microbiology background. I started out in healthcare, worked in microbiology labs. I did testing, diagnostic testing, infectious disease. And then I discovered public health very late. It wasn't until I was looking at grad school and options and if someone mentioned public health and I started exploring and it's kind of similar to what you described. It was like, oh, for me, this was like, oh, this is what I really wanted all along. I just didn't know that it was a thing. And so that was like a big aha moment.
Mm-hmm.
So then I'm assuming, did you just decide to go, you got your advanced degree and then did you expect to work as an epidemiologist or did you work as an epidemiologist?
I was hoping to get an advanced degree. I had a brief stint in private industry working in quality control for a chemical company. I applied to graduate school in the hometown because I was anchored right there, and I didn't get in. And I thought, well, that's understandable. They wanted more than I thought I had. And they sent me a letter saying, oh, Mr. Brown, thank you very much, but, we're unable to accommodate your application at this time. Little did I know, I was applying for the spring semester when they didn't accept anyone in the spring semester. And in July, I got a phone call. And this is sometimes how people's careers and their life paths change. I got a phone call. And the woman said, hi, is this Mr. Brown? I said, yes. She said, well, this is so-and-so, and I'm the department chair in epidemiology. Are you still interested? Reading between the lines, are you still interested? Get your happy hips over here and resubmit your application, which I did. And about 3 weeks later, I got a congratulatory letter. And yeah, that was the beginning of the path through the advanced degree.
Ah. That's that's interesting. So did you just, when you completed that, you just went into teaching at that point?
During my time in the master's program, I took a leave of absence. I had an opportunity to do something that was one of those sentinel events and experiences in pretty much everybody's career. And I wrote to WHO and I volunteered to be a part of the smallpox eradication program. And I tried to sell myself. I said, look, I'm a veteran. I've been in tropical climates. I understand that India and Bangladesh are tropical. I would have no problem. I'm a second year student. They said, when can you be in Bangladesh? So I spent 4 months there. Absolutely phenomenal experience. And then I came back and I finished the master's program. And it occurred to me that I didn't know enough. I didn't think that I knew enough of some of the more technical aspects of epidemiology in order to go out and function. So I applied to the doctoral program, and oh my gosh, they accepted me. I applied to the PhD, and they said, well, we don't have a PhD yet. It's still in the making. However, and see, one of the things that happens in life is people give you these hints, and they said, but we really think you're more suited for the DrPH. Come down. They didn't say it in the letter, but come down to student affairs and change your application from PhD to DrPH. And about 3 weeks later, I got an acceptance letter. So the paths in most of our careers are full of hints and whispers that sometimes, if we are paying attention to the whispers, they oftentimes result in a positive outcome. So finishing the doctoral program and a brief postdoc, a friend said she was teaching and she asked me if I would be interested in taking over her class because she was moving out of town. And I started teaching. It was at a university that I had a cumulative 0.0 GPA, and I didn't, statute of limitations is over. Okay. So I attended that university as an undergraduate for a summer, sweltering heat, in a chemistry class that I did not understand much of what was going on. And I got discouraged and I just left. And I said, they're never going to see me on this campus again, ever in life. About 7 years later, I was on the campus again at 6:45. And I walked into a building and there was a class, young people. I looked around. There was nobody there looked like me. But I walked up to the front of the classroom. I said, good evening. This is Health Sciences 488, Intro to Epidemiology. I'm Perry Brown. I'm your instructor. That was my return to the campus. It wasn't one of those valiant returns, but it was actually quite humbling to come back and to see on these kids' faces, for the most part, there were only 2 African American instructors at the university, and I knew one. And so that was the beginning of the academic teaching, and I loved it.
Wow. I bet you never imagined that moment, right?
I never did. I never thought about becoming an instructor. I knew that I enjoyed teaching aspect. I enjoyed tutoring in the graduate program. I tutored my other classmates in Epi and in Biostat.
So what did you love most about teaching in those early years?
I love my perception of students having aha moments when we went through a complex or a complicated or an involved concept like age adjustment. So those of you listeners out there who are thinking about, oh my God, there he goes again. But to see someone light up and say, I get it now. Those are the kind of moments that make teaching so enjoyable and rewarding, is bringing someone from the darkness to the light, so to speak.
So when did you first get to FAMU?
I came to FAMU. I was at a medical school for about 11 years, and I was soft money.
What's soft money?
Soft money meaning my salary was grant funded, initially from an institutional grant, and then subsequently from a research grant, a couple of research grants that I was the head of. And being soft money in some ways is like looking for the low-hanging fruit. And sometimes the motivation for the grant application changes from the love of the science and wanting to answer the question to if I get funded, can I pay the mortgage? Sometimes people who are soft money, so to speak, who have a research agenda that carries them through their whole career. And at other times, at one time I was on 5 different research accounts, 2 of which were mine and 2 of which were the other 3 were colleagues for which I was one of the investigators. So, we pieced together things. After 11 years, it's like in sports where a ball player strikes out multiple times before they get a hit. And at the time, in 1997, the public health program here at FAMU had been approved and they had a budget for faculty. I got a call from a colleague who said, "You want to come to Tallahassee?" I said, "Hold on a second." I put the phone on hold and I went and looked on the map. Okay. And I said, "So what's in Tallahassee?" And he told me, "New public health program, orientation towards teaching, do research as you wish, brand new orientation and emphasis is on teaching." And I said, okay. My first conversation with my director lasted 90 minutes. We talked about everything and it was absolutely delightful. Sometimes you get a hint about what your circumstances are going to be based on conversations that you have. She's in the office next door to me. I've been with her for 27 plus years. I can't say that there's ever been a bad day.
Wow. That is amazing.
I've been blessed.
Well, we were chatting about this before the recording. And even when I first met you, we have some of the people that I know that know you. When your name comes up, they smile, they get real bright and happy. And so I can imagine amplify that by probably hundreds of students that have that feel, that sense, that reaction when your name is mentioned. What are some of I know epidemiology is your niche, but is there a particular population or specific type of issue that you're most passionate about?
If that was a multiple choice question, I would say all of the above. But since we don't have that much time for me to go into everything, my initial experiences in public health were in infectious disease. I had subsequent experiences in cancer prevention and coming here to FAMU more recently in health disparities. And I would think those 3 probably occupy 80% of my passion. Understanding why things exist the way they do. Disparities. Why? Infectious disease, we here at FAMU were involved in some of the early activities with COVID here in Florida. When one of our students, our doctoral students, who was the assistant deputy of health, called my director and said, "We're going to need about 100 epidemiologists because something's coming." That was a Thursday night question, like in the movies. The subsequent phone call on a Saturday with all of the people involved in public health around academic public health, everybody bought into, we're going to provide manpower, woman power, person power to help address this. And so a group of us from FAMU, along with some other institutions, we were the backups for the Department of Health. So COVID has been probably the more recent or the most recent activity, and it still is. I keep track of what's happening in COVID. It's kind of, my emotions go up and down. I'm happy when people say they get vaccinated. I'm concerned when people say they don't want to get vaccinated. But infectious disease now, which is something that used to be a relatively minor concern because public health and epidemiology has kind of focused on the chronic stuff. And now we're refocusing back to more of a balance with infectious conditions. And yes, we know, and it's predictable that there's something else coming, just a matter of when.
How do you bring that into the classroom with preparing your students for, the work?
In the infectious disease course, we do a couple of things. One of the modules in that course is mathematical modeling probability of successful transmission. And it's really kind of a bivariate kind of a model, a binomial model, I should say, in which we calculate escape probabilities and transmission probabilities under certain circumstances. How many contacts there were, how infectious is the infectious person? Are they 50% infectious or are they 100% infectious? what is the relative population density? And so, in going through these things, one of the things that students, I would hope, come away with is number one, transmission is not very easy. But what we see in things like a pandemic, there are just so many people who are infective to others that even if you model it, you could come away with some prognostications that may not hit the mark. And the other thing that I hope the students come away with is all models are wrong. That's a hard statement. All models are wrong. And all predictions are wrong. If you predict there'll be 2 cases and there are 3, you were wrong. But that's one. 2, for students to understand that infectious disease is partly what people do and how they do what they do, but also the circumstances that they find themselves in. More often, circumstances that they can't control. And a lot of this is captured in social determinants of health. However way you model social determinants, whether it's the 5-component model or the 7-component model or the 12-component model, the majority of the components of those models are out of the sphere of control of the individual. And therefore, as public health people, addressing those other areas that the individual can't control oftentimes is a matter of forging relationships that can result in addressing some of the issues that people may not be able to control individually. So it's not to indoctrinate, it is to get students to look at maybe the broader picture and ask the question, why? And when you get a response, you get an answer to why, it always leaves another question. And the other question is, well, why? And so you keep going down this path of why. Eventually, you come to a point where interventions and other kinds of collaborative efforts can come together and address those components in social determinants of health. Because as we know about interventions, and I think it was somebody like Albert Einstein that said every complicated problem has a simple solution, which is always wrong.
We're doing really well with time. I'm enjoying our conversation and listening to what you're sharing, and I'm picking out a lot for myself. I like the piece where you talk about the core or the connection, or pointed to the importance of relationships. And that's something that I speak to all the time. I think asking a question of why, even being able to ask the question why amongst ourselves as epidemiologists or the public health practitioners, but also within the communities that are at question, all kind of goes back to relationship. There needs to be that relationship to be able to have that level of conversation as you're exploring through, would you say?
Yes. If I could share one experience that was informative and absolutely humbling, I was on a panel discussion about epidemiology to some young people who had not entered into the field of public health, but to explain what epidemiology is. And these were primarily minority students. And I said, it is important for you, should you choose epidemiology or if you choose any other field, particularly in public health, it's important for you to answer the sentinel questions disproportionately affecting minority populations and low-income populations. And the speaker, who's after me, said, Dr. Brown, as eloquent as he may seem, is absolutely incorrect. He said, it's not important to answer those important questions. It is imperative to ask the question. And as you ask the question, you frame the direction that anyone else has to go in order to answer it. And I thought, and I raised my hand and I said, he is absolutely correct. It had escaped me. So we do answer some of the important questions. However, those questions are often posed by people who may not know that they are in some ways directing the pathway to the answer, which sometimes won't get us to the answer that we need to have. But in answering the question, particularly as, let's say, as people of color or people whose background is from low income, framing the question is when you ask it in such a way that whoever answers the question must go down the path of the framer. And I thought about that. I said, yes, it had escaped me.
That's really good. That's so important for all of our work, especially in these communities. And, my consulting work, we focus on BIPOC communities and organizations that serve BIPOC communities. And the very last thing we want to do is go in and answer the questions that we're asking. But it's important that we frame the question so that it sets up for a really good conversation with the community. The community is involved in the discussion. We're just not asking and answering. So that framing of the question invites the community into the conversation.
Yes. And this is, in large measure, the concept of community-based participatory research, where the community asks the questions. We don't ask the questions. Community asks the questions. And in doing so, they frame the direction that university eggheads move to provide the answers. But what's important is to provide the answers and provide it in a manner that is digestible.
Thought-provoking conversation, Dr. Brown.
Well, thank you.
I am really enjoying this, and I think I'm going to ask one more question as we wrap up. And I'm sure this is not going to be difficult for you at all. I'm sure you bring this up often, but our podcast audience is a mixture of students, young, early career, mid-career, senior career professionals, and even some entrepreneurs, folks that are working at various government levels and so forth. So as we begin to kind of think about the various touch points, and you've already dropped such wisdom throughout the conversation, but is there any bit of advice that you would share for our listeners as it pertains to putting into some action items, some steps, applying epidemiology or connecting with communities, just some bit of advice that you could share with our listeners?
There is a saying that I've heard over and over again, and that is plan your work and work your plan. So planning one's work is identifying where one wants to be and identifying what one wants to do in the future. And the caveat to that is not being so rigidly invested in that plan that one cannot accommodate small diversions while still maintaining the compass that takes you forward. And I would say to young people, entrepreneurs, people who are in entry-level positions within organizations, the entry-level positions in organizations, if you look in front of those entry-level positions, there are a myriad of other positions. I've seen it in public health practice. A person comes in, they do well, there's another opportunity that is a next level up, a next level up, and the next level up. And people more oftentimes, they move laterally and then they continue up in that plan of their work. And then they move back and they continue going forward. So I would say, think about where you want to be and what you want to be doing. Assess what it takes in order to get there, but don't be afraid of the bumps that may come along. Don't be afraid of taking that step out to the side, but continuing to go along that path.
That's great advice.
That's what I would say to anyone coming into the field.
It's a great reminder because that's valid regardless of if you're new or you're just transitioning mid-career. You need to just have that plan, but not be afraid of the bumps that comes along with it.
Don't be afraid of the bumps. My early academic career was full of bumps. I was the smartest kid in chemistry the 2 times that I had to repeat it. Whenever I would show up in class the first day, everybody would be happy because I brought down the curve. My 5 out of 100 on the chemistry test meant that other kids' 15 could be an A. Enough of those experiences resulted in a letter from the registrar's office that I received in June of 1967 that said, "Dear Mr. Brown, we appreciate your coming to Cal State Los Angeles. However, as we are looking at your grade point average and your experiences, et cetera, we cannot recommend at this time you're moving forward to upper division, and consequently, we wish you well in your further economic educational pursuits, but it won't be here. And I got the letter. I knew it was coming. And I put it on the dining room table. I went to work. I had a night job, which is probably why I was getting those kind of grades. And I came home and my father was sitting at the dining room table. He usually went to bed earlier. And I came in. I said, hi. He said, hello. I said, oh, you see the letter? He said, yeah, what are you going to do? I said, I'm going to community college, get my grades up. He said, great. He got up. He went to bed. He never asked me about anything again. To which that is a story that I have employed a few occasions with the students sitting in my office teared up because they got a C in a graduate course. Don't worry about the bumps. Take a step to the side, go around the bump, which usually means repeat the course. No one, and I also said, no one will ever ask why they repeated infectious disease. No one will ever ask why they got a C in biostat. What people later on in their life want to see is that MPH, that DrPH, that PhD. That's what they want to see. The details don't matter because having attained, working to plan, having attained that is proof in the pudding.
Well, thank you for sharing that, Dr. Brown. I don't want to edit that out. I want to keep that in there. That's going to help somebody.
Okay, I hope so.
Yes, this has been a great conversation. I really do appreciate you sharing insights and wisdom and some comforting words and encouraging words and sharing a bit of your journey. It's really been wonderful. You said it to everybody that, I'm invited to FAMU, so we got to plan it out. And I want a nice tour so I can see all the buildings and the beautiful grounds that I keep hearing about.
It's still beautiful, even after the 3 tornadoes that came through here in May.
Yeah, I mean, Tallahassee is pretty resilient.
It is. My daughter came here and she looked at, when she was on her first trip here, she said, the license plate says the Sunshine State, but it looks to me like it should say the Tree State. Tallahassee is a city of oak trees. As you go south, the ecology changes. It becomes a lot more tropical-like.
Well, I'm looking forward to that. I've been through Tallahassee. It's been so long ago, but I've never been to that campus. So I am very much looking forward to it.
Well, we will see if there's a venue. We will bring you down.
Yeah, it sounds like a plan. Well, thank you so much.
Dr. Huntley, it's been my pleasure.
I'm going to make sure we have links for everyone to connect to you who want to get in touch and just get to know more about you. I look forward to keeping in touch.
Well, thank you very much. I look forward to seeing the link and responding to anyone who wants to contact me.
Awesome.
Okay. Take care.
I really hope you enjoyed that conversation as much as we did. Dr. Brown is a true leader, bringing his rich knowledge, lived experiences, and wisdom to the classroom every day. He is truly having a big positive impact on the FAMU community and beyond. I encourage you to connect with him as well as FAMU to learn more about Dr. Brown's work and the university. You can find the links to connect on the show notes page. The show notes page for this episode, which is 392, can be found at phecpodcast.com. Once you're there, just navigate to episode 392 to find its show notes. One more thing before we go, please take a moment and share this episode with a friend. I'm sure you know someone who would really be interested in hearing this conversation. And if you're listening right now in the podcast app, any of the podcast apps, you can easily share this episode through a text or share it directly to social media. If you're on the show notes page, scroll down to the bottom, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.